Western Spring Television. Ours it is.
All right, thank you. Good to be here again on the program, Spring Clinic. Of course, Spring Clinic back to winning ways. This is where we'll talk about health related matters, and of course, we bring in professionals to enlighten us on some of these health issues and matters. You know what I say about health? Health is wealth. My name is Femi Ocho, and I'm holding forth for Femi Adefila. Of course, it's going to be a very interesting one today. And of course, we have professionals grace this program to talk about their area of specialization. And today is going to not to be different in a kind of way, but then it gets more interesting here, Spring Clinic on Western Spring Television. And I'm here in the studio with experienced, very experienced, and of course, professional pharmacists. We are going to be talking today what has to do with pharmacy. Definitely, you know, some angles to it as well. And it gives me great pleasure to welcome pharmacist Felix Adedoyin, the Managing Director for Help Pharmacy. Good afternoon, sir.
Good afternoon. Thank you for having me.
Good to have you here to join
My
us.
pleasure.
Of course, you know, it's a program that you learn many things from, especially the subject topic of today, talking about pharmacy, many angles to it as well. But then, before we go deeper into the conversation, there is a report that we have for you to have a clearer view and a perspective to the topic of today. All right, we'll get that very soon as well. So, Sir has an experienced pharmacist for assuming for people like us laymen or a layman as myself and our distinguished you know viewers across the world watching us right now. What exactly is pharmacy?
Has a very broad feed
Mm.
because incidentally, I've been invited to give a talk in 2 days' time on Thursday.
Oh,
So just a set of young people, just to inspire them to choose pharmacy as a profession. So I will just go in line with what I intend to speak
okay.
to them on Thursday.
Mm.
Once we talk of pharmacy, you are talking about a feed that has so many branches. But primarily, the word pharmacy can simply be defined as, or pharmacist can be defined as a set of people that are experts on drug matters or on medicine matters. So pharmacy can then be said to be a profession that deals primarily with medicines. That used to be the traditional way of looking at pharmacy.
Yeah.
Primarily medicines oriented. But it's, some couple of years back now, it's been moved forward from medicine oriented to patient oriented, under which now pharmaceutical care. So the word pharmacy is all encompassing. It involves research on medicines. It involves production of medicines. It involves dispensing of medicines.
Yeah.
And then involves giving pharmaceutical care, patient-oriented clinical pharmacy with respect to dealing with each patient concerning usual medicine. So like I said, it's a very broad field, ranging from research to production, from production to even marketing. It's still under pharmacy. We have pharmacists that are basically involved in just marketing of pharmaceuticals, and they're also pharmacists. So it's quite a very broad field.
Yeah, you know, for just like I said, laymen like us, you just think it's just about the dispensing of drugs across the counter, and then you give you are given whatever you ask for, 2 in the morning, 2 in the evening, and then you see some funny writings that only pharmaceutical persons can decode, and then you go home. But then we get to interrogate that further. I talked about a report earlier, and you will have an informed angle and what is happening as pharmacy is concerned.
Days of treating common illnesses like malaria, typhoid with just 1,000 naira have gone down the drain. Since the price of drugs skyrocketed in Nigeria, access to basic healthcare has been like passing through the needle for many, and Bola Adedokun is one of them. Mrs. Adedokun walks into a pharmacy store for a purchase of malaria drugs but was taken aback by the cost of drugs. She had to settle for the cheapest product. Mrs. Adedokun, who lamented the high cost of drugs, says it has pushed many to the walls of local herb sellers.
To treat malaria before, if you have 1,000, 1,200, you can easily treat it and be okay. But now, only Quaterm is now 1.7. To combine two antibiotics with it, with original, it will be like 1.7, 1.6. And this Igbo made one that they have, they say there is no amoxicillin, Bicham. So we have to go for that 300 naira one. That is two. At times it might not even work. You might still repeat it for the second time before you'll be okay. So before you be combine pain relief together with it, it will be over 3K. Before, if you have 1,000, 1,200, you are good to go, and you'll be okay. And another challenges you have is that the drugs are not as good as before. The work is not all that perfect. So many people will combine agbo together with it now.
Adebayo Adebare, a community pharmacist who also has his own fair share of the effect of soaring prices of drugs, says the situation has snowballed into disease resistance for many patients who cannot afford to buy a complete dosage of prescription.
Now patients cannot even have access to complete treatment of malaria with a token of 1,500. So it's no more realistic unless you want to just go for there are some drugs we call prophylactic drugs. Prophylactic drugs, they are not drugs that are actually going to do the complete treatment of your ailment. It's just going to suppress it, so for prophylaxis purpose. So it's going to suppress it. Maybe it's just mild cases. So people have resorted into that just to find means of shielding away from the negative effect of the cost implication, the rise in cost of drugs and everything. And this has actually taken a negative toll on the community, not even we business owners alone. We business owners, we have our own implication. We have negative implication on us. Number one, ranging from the patronage. The patronage has drastically reduced. When we now go back to the implication it has on the community, there is something we call, resistance to drugs. And resistance to drugs happen when you don't use the right combination of drugs to manage your disease condition. So when patients now come and they come to the pharmacy to complain, now due to the high cost of drugs, they end up not buying. So they go back to the local chemist or the roadside herbal sellers and just look for, please, I need that, I need this, I need that, just to provide a little bit relief. All these things contribute to what we call disease resistance. So no matter how much they use all those things, it will not even work on them. So by the time they now feel so down and they cannot even cope again, they will have no choice to come back again. Now the disease condition you could have managed with just 2,000 naira, even with the high cost of drugs, you will now end up even spending more.
But amidst the ripple effects telling on pharmaceutical businesses, the local herb sellers seems to be making headway in their businesses as a visit to a store in Osogbo, the Osun State capital, shows high demand for local herbs concoction. Their customers range from people with malaria, typhoid, diabetes, among other ailments.
Àwa ní àwọn customer lóríṣiríṣi tí wọ́n ń ra àwọn àgbo wa yìí. Ó bẹ̀rẹ̀ lórí ibà gbogbo ẹ̀ tá à ń fi ń tọ́jú àwọn èèyàn, àtọ̀sí ni, alẹ́ ni gbogbo ẹ̀ tá à fi ń treat àwọn èèyàn. Lọ́pọ̀lọpọ̀ àwọn èèyàn ni wọ́n wá ń bá wa rà á lóríṣiríṣi tó dé ìlú èbó.
Wọ́n wá ra àgbo ibà àti ara ríro. Bàbá lọ hospital owó tá a ti ná tá ń fi ra oògùn tẹ́lẹ̀ ní chemist ó ti pọ̀ ju agbára wa lọ. Tá bá lọ hospital oògùn tó à ń kọ fún wa, tá bá dé chemist ìlọ́po ìlọ́po bí ọ̀nà bíi ó tiẹ̀ kọjá ọ̀nà bíi mẹ́ta báyìí ó ti ń lọ bí ọ̀nà bíi mẹ́wàá tí wọ́n á kọ tó jágbá agbára wa ò dẹ̀ ká mọ́ bí ọrọ̀ ajé nàìjíríà ṣe rí báyìí ń sìn òkè paracetamol tá ń rà ní bíi bóyá 100 naira là ń rà tẹ́lẹ̀ báyìí ń sìn ó ti di 150 200 naira gbogbo àwọn oògùn ẹ̀ tábà òun la ṣe kọjá sí ọ̀dọ̀ ìyá alágbo ibi tá a dẹ̀ ti ń ràgbo àgbo yẹn ń ṣiṣẹ́ dáadáa.
Speaking on this trend, Bankole Kamarudin, Osun State Chairman of the Association of Community Pharmacists of Nigeria, says resorting to herbal remedies that cannot be measured can further worsen a health challenge.
People are hypertensive, some are diabetic, they have already been diagnosed over years, and there is need for them to continue to maintain certain drugs to keep their body in a good state.
Earlier last month, the federal government announced plans to reduce the importation of drugs into the country from 60% to 40% to promote local manufacturing of drugs, a move that is telling on the cost of drugs as not much manufacturing comes from the country. Amidst the economic woes bedeviling the country, a British multinational pharmaceutical and biotechnological company, GlaxoSmithKline (GSK), the manufacturers of products like Panadol, Augmentin, Ventolin, Andrew Liver Salt, Maclean's, among others, announced plans to cease operations in Nigeria after 50 years of service delivery in the country. Toby Sanusi, Western Spring Television News.
All right, you're welcome back from that report. Quite instructive. There are many things being talked about. We get to that part, the high cost of drugs, you know, some drugs that when you get to pharmacy shops right now, sometimes they tell you it's not available, or some that used to sell at a particular price before, it's now skyrocketed. Of course, you know what I'm talking about, but we get to that point. But quickly, pharmacy shop and patient medicine shop, is it the same?
They are not the same in any way.
Okay, so what's the difference? The sizes or what?
It's not in the sizes, it's in the scope of operation.
Okay.
Legally.
Okay.
By Nigerian law, there are limited drugs that Peter Medicine stores are expected to store. Let me quickly go back to the history so that that will throw more light on what we're talking about. Peter Medicine store came into existence because at the time we had very limited pharmacists in Nigeria. Then we had limited pharmacies also.
Okay.
In order to avoid a situation where somebody will need something as little as ordinary Gelucy tablet, or need something as simple as paracetamol tablet, then you have to go very far to a pharmacy to procure that. That brought into existence Peter Medicine stores. So Peter Medicine stores are actually primarily expected to store what we call over-the-counter drugs, OTC.
Okay.
Drugs that you don't need any professional advice over, you don't need any professional expertise before you can give them out. And we call them over-the-counter. That means there is even no need for any diagnosis at all for you to procure them. And these are drugs that are expected to stock. And I'll give you examples of them: your paracetamol, your Gelucy, your ordinary cough syrups, and stuff like that. But once you go beyond that, you're going to drugs like your anti-diabetics, your anti-hypertensives, and more serious medicines, which we refer to as ethical drugs or prescription-only medicines.
Okay.
They are not expected to stock such. Those ones are completely under the purview
Talking about patient medicine.
Peter Medicine store. They are not expected to stock such items. Those ones are completely under the purview of pharmacists, of course, to be sold within pharmacies.
Yeah.
So, but what we have in Nigeria is, Nigeria for wash is people go beyond their limits, go beyond their boundaries. You find Peter Medicine stores stocking what they are not expected to stock, what they don't even have any knowledge about. Mostly came to me on Saturday now.
Yes.
Diabetic. And by the time I was through with her, I advised her on how to increase the dosage of the drugs vis-a-vis the results she's getting from the test. I don't know if no Peter Medicine dealer will ever be able to do that. Yet, you want to stock diabetics, you want to stock anti-hypertensive. So, they cross the line. And people out of ignorance go to them to buy such. But normally, they are supposed to be limited to only over-the-counter drugs, not ethicals, not prescription medicine.
All about talking about prescription of drugs, is that within the purview of the pharmacist or the doctor?
Doctors. Thank you for that question. A very good question. Recall I told you that many years back, pharmacy was more of medicine-oriented or drug-oriented.
Okay.
We all just do is manufacture medicine, give them out to your patients. You don't really have much involvement in terms of clinical dimension. But we have moved far away from that stage. Currently now we have what we call clinical pharmacy, under which there are certain drugs that can be prescribed by pharmacists, which is allowed under the law.
Legally?
Legally. And I'll give you an example. Patient counseling is under the purview of the pharmacist. The woman I told you about has been on her drugs all along, combination of Downy and metformin. So, looking at the results she was getting from the blood sugar test, it became important for me to advise her that if with one 500 milligram in the morning and 500 milligram in the evening of your metformin, you are still getting these poor results, and with one tablet of your Downy, as a pharmacist, I know that you can increase the dose of your Downy, you can increase the dose of your metformin. I've been trained enough to know that. I
guess maybe you might not be mentioning the name of the drugs because of some persons that might just be watching
and just go and pick them up.
It up.
Yeah. So I'll advise her on how to increase the dosage, which is still within what is expected of me as a pharmacist. So it's not as if I am the one that prescribed those drugs. But under patient counseling and clinical oriented pharmacy, I'm allowed to be able to increase the dosage and then check later. Of course, we know our limits. So there are certain drugs that, as a pharmacist, you are not expected to prescribe also. But even in the Western world now, there are certain drugs, even in the UK, that have been moved under the pharmacist. The pharmacist can prescribe comfortably. And I will give you an example of them. You're refilling your antihypertensives, refilling your antidiabetics. Why do you need to go and see your GP each time you need to refill your antihypertensives? Then you are underutilizing another professional that has been well groomed in that area. So even the Western world, they move beyond just pharmacists giving out drugs and just telling them, go and use it this way. You're allowed to prescribe certain drugs.
You know, some will say, sometimes does it bring friction between the doctors and the pharmacists? Is it ego, or is it mind your business and mind my business kind of a thing, or is it supposed to be collaboration actually?
Thank you for that question. I think for me, I wouldn't blame the doctors. Neither will I blame my colleagues. I think the real problem we are facing here is people crossing their limits. Like I spoke about the patent medicine the other time. You find the same thing happening even between doctors and pharmacists. If you come to my premises, for instance, where I superintend, you won't find me give injection. If you go to, we have other outlets, we are doing superintend, I employ younger colleagues to man them. They already know we. You see?
But some do.
Some do. That's why I tell people going beyond their limits. It's just my own style of practice. I don't do it. But there are pharmacies that have been trained, licensed to give injection.
That's allowed.
It's allowed. In fact, you could go for some few weeks of training where you'll be certified to give injection. I have colleagues that have been certified now to give injection, and they do. But I don't. I think for me, it's all about knowing when to draw the lines. I draw the line easily. If you come to my premises, it doesn't take me long to refer you to a doctor. I have a lot of doctors that I refer people to. Please go and see this ONG man. Please go and see this eye specialist. In fact, you find patients who are sometimes reluctant to agree. And that's why I'll put the blame also on our patient too.
How? And
I'll tell you why. Here you are telling a patient that with all that you have said, I wouldn't want to give you any medicine. But I'll refer you to a particular doctor. And the person is still like, oh, can't you just get something to give me?
More like, why will you allow me to go through all this stress?
At that point,
people do it just down the road.
Just give me this thing. So at that point, a pharmacist that is not conscious enough of his professional stand may be tempted to want to give something. But for me, I refer readily. I refer easily. And I think another thing responsible for this is greed on both sides. Greed on the doctor's side, greed on the pharmacist side. You find pharmacists that want to do all the treatments in this world. You find doctors also that want to stock all the drugs in this world. So that's why I say you can't blame either side.
What side?
When doctors are complaining that pharmacists are prescribing drugs beyond what they are expected to prescribe, they also know that. I'll give you an example now.
Yes.
How will the patient walk in? And you know that the patient is having maybe ordinary eczema, is having boil, is having ordinary whitlow. These are common ailments. We call them common minor ailments. No, under medical care, we refer to them as common ailments.
Okay.
So these are common ailments or minor ailments. Such can still be handled by the pharmacist. And I do all that. They come in to treat malaria, cough. But once it gets to certain areas, you know when to draw the line and then refer to a doctor. So we have some pharmacists that cross the line and just keep treating. And like I said, on the side of the doctors too, there are certain drugs they are not expected to stock if they don't have a pharmacist on their premises. But I see them stocking virtually everything. So that's why it's difficult to put the blame on the pharmacist. Because I was once invited to a place and I said, if you get them, finally doctors pulled back. I was called up to the Ministry of Health then. Some doctors came and said that a lot of pharmacists in town, they have patients lined up, they attend to patients. And they said we should come and, I was the chairman of our session then to come and meet them at the Ministry of Health. So we told them we'll come. But they also should be prepared for the fact that we have to explain why they stock certain drugs that they're not expected to stock. But the meeting never had. So that's why I said it's on both sides.
That sounded like we against them kind of a situation.
So it's, everybody should just know their limit. For me, I don't go beyond my limit. For my customers can readily tell you that once I do the basic, what we call minor ailments, common ailments, which everybody knows.
All right.
Malaria parasite test can be checked up in the pharmacy now. Blood sugar can be checked in the pharmacy. All those common stuff.
All right. You know, that's very good to know. Now, the report we watched earlier, you know, it was majorly about pharmacy, but more instructively about the high cost of drugs. You are in the business. Professionally, you are there. As a businessman, you are there as well. So, what is happening? You saw that report.
It's actually pathetic. That's the
pathetic.
That's the
word
way I
to
can
use.
put it. Extremely pathetic. In fact, sometimes when we procure and we have to upload, in the course of uploading, you start asking yourself, this thing was just this price. The last time we procured. This time around, this is the price. You find items that have soared up as much as 100%. 100%.
Just within a short
within
space of time.
within about 4 or 5 months. We have items that we are selling for like 5,000 over 10,000. And these are drugs for serious ailments. And I talk about minor ailments. These are drugs for serious ailments. You have your patients that have glaucoma. You have a patient on insulin. And these drugs have jumped up as much as 100%. So it's extremely pathetic. Extremely pathetic. I don't know what our government can do, but you see, by and large, we all know the cost. Each time people come in and they complain, I tell them, our biggest problem is that we don't manufacture most of these things here. I can comment that over 80% of drugs we consume in this country are imported. So
over
it means
80%,
that over 80%.
of
So
what
it means
we consume as drugs
are imported.
are imported.
So even the ones that we claim that we are manufacturing here, they are what we call API, active pharmaceutical ingredients, are imported. So you find a manufacturing outfit claiming that they are manufacturing paracetamol tablets. Fantastic. But the active ingredient now is still being imported.
We don't do it here.
We don't do it here. So by the time EMZO is about going into that, we hope they are working towards February from what we were told, and we hope that more companies will come up. But as of today, our APIs, which is active pharmaceutical ingredients, are imported into the country.
Is it lack
so
of
whatever happens to dollar, to the exchange rates, will automatically reflect on medicine.
Now, you talk about having those active ingredients, you know, majorly not produced here. Is it because of lack of capacity or technical know-how? Is it because we can't do it? The knowledge is not there?
The knowledge is
or
there.
Is the funding? Or what's wrong? Because let's take paracetamol for example. Why can't we do that
The ingredients,
100% here?
The environment is not that friendly to
When you
manufacturers.
say environment, the business
The
environment.
business environment to manufacturers. The average person, I for instance now, there have been a few times that I contemplated if I go into production. Some other time I will pull back again. The environment appears to encourage more buying and selling. So you find people preferring to just go. In fact, I give it to a company like Emzo. They started with production of the Emzo paracetamol tablet, which is known all over. At the time, they also went into serious importation. So imagine that trend. A company that started with production. Well known for production. At the time, veered off into serious importation again. And now they are coming back into production. I believe maybe at the time they just felt it's not all about money. It's about giving back to your country. The environment doesn't really encourage production, starting from power to the exchange rates, to so many factors, to human factors that could discourage production. I spoke to a senior colleague here in Osun State who is into production. I won't mention him here, there in Elisha. He told me that he traveled to Ghana. He went with some of his staff to just go and study. He's been to other places too, but he said, let's just get to Ghana. I got to a pharmaceutical company there, and he saw their generator looking so new. So he told them, you've not been using that they can't even remember when last they owned that generator.
Because there was no need to power it.
So our environment doesn't really encourage production. By the time you look at the cost of production, look at imported products cheaper than what is manufactured there. So you just feel like, let me just import. All I need is just a warehouse. We house the things and then get some cars to just market it. As compared to the whole lot of headache as I said with production. So production is actually a bit more challenging. It's not, can't compare it to buying and selling that anybody can easily go into.
As a pharmacist and of course as a store owner, how is that affecting business?
The prices of
the inflation on these drugs.
Is it to a large degree? I would say it hasn't really affected our business as such. In all sincerity. Is it, when I was coming here, I made up my mind, I will speak for my heart and I will speak the truth.
Yes, please.
So the truth is, it hasn't affected. If anybody should say, oh, it has affected our business, business is not, it's not, I don't know for any other person, but for me, I would say it's not. Because looking at the figures, and the records,
it shows that it's still.
But you see, the problem is that people have no choice but to buy.
That's
They're talking about something that has to do with life. It's just that when you say to them you feel the pain. When you look at their eyes and you see that this person is bringing out the money grudgingly, you feel
from a place of pain.
I told you of a drug that we were selling for just about 5,000 a few months ago. As of today, we sell over 10,000, and this for diabetes. So you wonder, but with the person will not want to die. Even if you have to borrow, even if you have to send to relations, you know, there's this communal whatever in Africa. If you have to send to an uncle or send to an auntie or you just have to get the money. The person can stay alive. So it hasn't really affected business as such. But I think, by and large, it's not all about money. I feel for our clients. Each time they come in, we have to reduce markup a little so as to associate, to accommodate some of these things.
All right, thank you. Still have pharmacist Felix Ade doing here on the program today, Spring Clinic. We'll be talking about pharmacy, pharmaceutical dynamics, the ecosystem, some of those concerns around it. And we'll take this break right now. When we'll come back, we take it home from there. All right, you're welcome back. And now let's talk about, you know, fake drugs. You believe with me, it's quite a menace. We're seeing some very popular cases of people that have been affected, and some lost their lives. Some had, you know, serious problems. How problematic is that for you as a pharmacist?
I don't see that as much of a problem, because once you are very careful with how you source your medicines, how you source your drugs, you won't have much headache in that regard. So we, as a company, we do our best to limit our sources of
How about
procurement.
in the
But in the
society?
general- On a general scale, I know that a colleague told me that she once went to the wholesaler, and the moment she saw fake, I forgot the item now. And from that time, she stopped going to the wholesaler. So what I would just simply advise is that there are still fake drugs all around, but not as much as what we used to have. When people make it look as if it's still as bad as what it used to be, I don't agree. We have really improved significantly. When I became a pharmacist, it was really a menace.
Yeah.
That even sometimes you feel like, what kind of a system is this? That people are banking on you to help them. And you that they are banking on, you can't even tell if what you are stocking is genuine or not. But we have moved far beyond that stage. Now there's a great improvement. For instance, now when you're talking about maybe a major distributor outside Osun State that we buy from, that major distributor too will make sure that he buys majorly from the companies and directly from importers. Drugs come in majorly through manufacturers or importers. So once a big distributor keeps to that policy, picks directly from manufacturers and picks directly from importers, that will reduce the likelihood of buying fake.
All right. For someone, a patient who just needs a drug or, some set of drugs, how can he or she identify when a product is fake?
Thank you for that question.
Because we heard at a time, okay, there are some things you scratch on a particular pack.
Yeah, there are some drugs. There are some, especially anti-malarials and antibiotics, that have that scratch card. That you can easily scratch and confirm the authenticity of what you have bought. But it's not all medicines. There are medicines that don't have that. I think for the patient to identify fake is almost impossible, except for items that have scratch cards. If you buy an item, procure an item that has scratch card, make sure you go ahead, scratch, test, and confirm the authenticity. But if a product does not have scratch card, there is no way you can tell whether it's fake or not. Because they tend to mimic the original as much as possible. That even professionals may not be able to tell the difference. And that's why I say, even for we professionals, what we do majorly is to ensure that you buy from a very reliable source. Looking at it on the surface, you may not be able to tell the difference between fake and original.
Now, let's talk about pharmacies. I learned that pharmacies that are registered, there are some that are unregistered. How can one know the ones that are registered, the registered pharmacies?
This is a very difficult one, because what we call annual license, which is expected to be issued by Pharmacists Council of Nigeria yearly to every pharmacy. So, but where the problem comes now is this: a pharmacy was registered last year because there was a pharmacist on ground there. By the following year, the pharmacist has moved to another place. The place has not been registered for this year, and then the pharmacy keeps operating. So what I would advise the public to look out for, though the public majority are not aware of it, just look up when you get into any pharmacy. Every registered pharmacy is expected to have what we call annual license, displayed openly.
Inside the store?
If you walk into our premises now, you see it. Displayed openly with the year of registration written. So the minimum I will advise anybody to settle for is previous year license. In other words, if you walk into a pharmacy this year, 2023, if you see any license older than 2022 license, then you should suspect that pharmacy. It means that even for 2022, the place was not registered, which is an aberration anyway. It's an aberration, but we know this is still Nigeria. We are so many abnormalities exist. Sadly. We expect that such places ought to have been locked up, ought to have been closed down by Pharmacists Council of Nigeria. But somehow they tend to have their way, they still escape. And then because of the logistics, The Family Council of Nigeria, Osun State, for instance, I will tell you, for a long time, they've not been receiving any, what do you call it now? Impressed or whatever from the national, from federal government.
To
In fact,
run their course.
To run their course. To even move around and see how big Osun State is, get to monitor these places. So if a pharmacy has not registered for this year and pharmacy is somewhere in maybe very far distance, they may not even have the logistics to get there.
Now, does it matter if a pharmacy is registered or not? Does it matter? Does it affect anything?
It's extremely important that a
How?
pharmacy should be registered.
How
And I'll
so?
tell you why.
Okay.
There are certain things that, as a professional, you will not want to do,
Okay.
which quacks will readily do. If a pharmacy is registered, the meaning of that is that there is a pharmacist that is bearing responsibility for everything that happens in that place. I do tell my staff that, see, you have to be extremely careful. If anything goes wrong in this place, I'll point to my license up there and ask them jokingly, whose picture is there? Say, that's your picture. If anything goes wrong here, nobody will ask for you.
Of course.
Nobody will look for you. By Nigerian law, they will look for me. But if a place is not registered, who do you even hold responsible? If anything goes wrong. Our other outlet here in Oshogbo too. Our pharmacists for last year relocated to the UK. He brought in other pharmacists this year. As I speak with you, he's on duty there. His license is the one covering the place for this year. If anything goes wrong in that place, he himself knows his license is at stake. So he's on his toes too, to ensure that everything is in order. As compared to a place that doesn't have a pharmacist, it means that it becomes a case of anything goes. Just do as you like, do as it pleases you. Nobody bears responsibility for whatever goes wrong in that place. But if a place is registered, a pharmacist knows the implication of anything going on there.
Yeah.
If I do tell you, you think there are no laws in Nigeria until something goes wrong. Then
you will
all the laws will now be brought to bear. Then you then know there are laws in this
There is
country.
law.
So
There
when
is
a
law.
place is registered, the mind of whoever is patronizing such a place should be at rest, knowing that there is somebody here that bears responsibility for everything going on in this place.
The issue of quackery, this is your profession. Let's take Osun State for example. Is it really something to worry about?
Yeah, it is. It is. Just
Is
like I just told
is
you
it so
now.
prevalent, or just a couple of?
In the Oshogbo, which is state capital now,
Yeah.
it's not that prevalent. Maybe because over time, we've had people man Pharmacists Council of Nigeria, and they have done good job in the past. Presently, too, they are not doing badly, except for the logistics problem I told you about, which is beyond them. Financial problem. They are financially handicapped.
Logistics, yeah.
Logistics. And so that has limited that quackery to more of
Interland, yeah.
remote suburbs and the rural areas. For the state capital, they are highly limited. In fact, they go into hidings. You see them in all these off the main road.
Yeah.
They go into one street, into one corner to operate. They don't really operate in the major roads. But I've been out with them on inspection on a few cases. I can tell you that in the remote areas, it's still a major issue. You get to a place, find somebody stocking ethicals that he doesn't have any knowledge of.
What's that?
Ethicals,
Okay.
ethical drugs, which
Okay.
I mentioned earlier. Ethical drugs, prescription-only medicines, as a patent medicine dealer that he doesn't have any knowledge of. So people come in and he just gives them. With that, he doesn't even know what to say about it. No professional advice, no patient counseling, and yet he stocks them. And then you find such places also because they are desperate to make money.
Okay.
So it becomes anything goes. Whatever I bring money, they are ready to do. So quackery is a major
And they
issue.
pick on the ignorance of the people
Is it people
around.
coming in and just wanting to buy? For me, a patient still came in this morning, a client that wanted to buy an item. And I told her not to buy. It takes a professional to do that. She didn't even tell me what she wanted to use for. But from my experience, I knew. Just mentioned the item and I said, who is taking this? How the person is not planning to use it to add weight? Because she said, yes, you made the person, you wanted this, wanted your this. You don't need all this.
Yeah.
the person will truly add weight on the surface, but it's false weight. We call it water retention. The person will just be blowing up, retaining water. And so it looks chubby on the surface,
Yeah.
but it's actually water retention. And so the person was like, oh, that's good. Please don't give us
Which
again.
that is not good for the
Which
health.
is not good for the heart. It tears on the heart, it puts pressure on the heart and the kidney when water is not being retained. And you find them all around. So when they come into a place like ours, where you have professionals, you'll be eager to discourage them from buying.
Yeah.
But if it's a quack, all you know is you want
Who just wants to make sharp business, yeah.
a whole pack, says it's going
Pay
well,
and go.
pick a pack. You want your deal, pick it and go. And these are drugs that are not meant for that purpose.
Yeah. All right.
Abuse.
Let's look at who is allowed by law to own a pharmacy or a patient medicine store. Who is allowed by law?
I will start by saying, as far as Finance Council of Nigeria is concerned, that's PCN, pharmacies are divided into like two. Two. You can have a retail outlet, you can have a wholesale outlet.
Okay.
By law, retail outlets are supposed to be owned solely by pharmacists.
Okay.
And it's just to ensure that you have professional coverage.
Yeah.
So if you go by that law, retail pharmacies are expected to be owned strictly by pharmacists. But non-pharmacists can own wholesale outlets. And why they're allowed to own wholesale outlets? Because they know wholesales or wholesaling does not require much professional coverage. Don't need to give any advice. Don't need no patient counseling. Whoever is coming to buy from you is going to retail. So that responsibility lies on whoever is going to retail.
So somebody that wasn't trained at a pharmacy,
Can own a wholesale outlet.
have any knowledge of how medicine works, can just gather some money and open
Start a wholesale outlet. But you need to employ a pharmacist.
Okay.
In fact, you need two pharmacists. You need what we call a technical director. That technical director must be a pharmacist, and he must be on your CAC. Must be one of the directors on the CAC registration. That's one. Then, apart from that technical director, who is a pharmacist, you also need to have what we call a superintendent pharmacist. That would be the pharmacist that will take charge and supervise the business for you. So you are the director, you have your money, but the professional side will be taken care of by the pharmacist. So you can own it. But you see, coming back to what we have in this country, they come around, they tell you they want to do wholesale. But they know they will not keep to wholesale.
Yeah. All right.
So they start retailing
Yeah,
again.
you know,
So
we have
it's the
to
same problem.
you have to start questioning them now. Two questions. And the first one is this: the issue of drug abuse. How critical is the role of pharmacy owners in helping with drug abuse? And of course, let me just add this one quickly, I think possibly you might have heard people say they feel drug is no more working. Like it's not as effective as before. Is it the drugs that's not effective as before, or the diseases are becoming stronger than the drugs? Two quick questions. You can do that one for us in 2 minutes.
Drug abuse.
Drug abuse, the role of pharmacists.
I just give an example now. If you're on grant, you have to offer advice when clients come in. Even without the client asking for your advice, you as a professional should be able to ask, who wants to take this? What do you want to use it for? And then offer
But it takes a mind that is not greedy to do that. Because most persons are just
they want to sell.
Yeah.
And that's why I said greed sometimes creates problems here and there.
Yeah. You said it earlier.
But as a professional, the role of a pharmacist is when you're on grant, I always insist that when I employ pharmacists, superintendent pharmacist to man an outlet for me, you don't stay in your office. You stay right on the floor there. Stay on the counter there. Even if you're not directly involved, be there not to overhear everything that is going on. So they can offer advice when necessary.
How about effectiveness of drugs?
Effectiveness, I don't think there's really any serious problem in that regard. I think...
Because I give you an example. That was when I used to, possibly have malaria. There are drugs I take. And that was the time I took like 2 packs and it wasn't really, and it was stated it was malaria. And many persons have that experience as well.
And that may not be... There are certain malaria parasites that don't respond to certain drugs. as good as artemether lumefantrine is, there is a particular strain of malaria parasite that wouldn't respond to it. So if you are told you have malaria, which of the strains
that
of malaria parasite is actually responsible for the malaria?
All right. Once again, thank you for being part of this program today.
Can I just quickly chip in one thing?
Yes,
the other
30 seconds.
time, 30 seconds. The other time you said, is the skyrocketing in prices affecting us? I think the major is affecting us, which my colleagues is your working capital can be wiped off within a short time. If I was buying something for 3,000 before, an item, I'm not buying it 6,000.
Of course. It's affecting.
That means I don't have enough to buy as much as I used to buy. That's a major issue. The capital wiped off, insufficient stock, and then that can be a serious
problem. Yeah, pharmacist Felix Adedoyin, the managing director for Help Pharmacy. Thank you for your time.
You're welcome.
And for your professional take as well. Maybe I need to come around and take some of this, advice. Thank you. The program has been, Spring Clinic. The program will return same time next week. My name is Femi. Just stay healthy, stay fit, and of course, always remember that health is wealth. Bye-bye.